My name is Chris Esposito. I'm the Vice President of Customer Impact for RQI Partners. I'm responsible for our field teams, including our impact managers, the group charged with supporting you throughout this transition process. I'm also joined today by my colleague, Russell Griffith. Russell is the Vice President of Strategic Research and Development for RQI Partners. Russell's team is responsible for all of the exciting new developments that you will hear about later today. Before we get started, just one bit of housekeeping. We are so happy to have attendees from all around the world joining us today. With thousands of you online, we will not be able to do a live question and answer session today, but we absolutely do want to hear from you. So please submit your questions using the web address shown here so we can capture and respond to everyone's questions in an open forum to allow everyone to see and participate in the Q&A. So I will pause here for just a second in case you want to write down this address, and we'll also share this again with everyone at the end of the presentation. The science is extremely clear. High quality CPR is the single greatest determinant of survival from cardiac arrest. The science is also extremely clear that BLS skills decay within 3 to 6 months. The AHA guidelines are clear. 2-year retraining cycles are not optimal. More frequent training in BLS and retraining in ALS is needed. There is substantial evidence to suggest that mastery learning is the key to skill retention and the prevention of rapid decay in skills and knowledge after simulation-based learning. Science is also extremely clear. Poor quality CPR is a preventable harm. We all know the components of high quality CPR. Minimize interruptions in chest compressions, provide compressions of adequate rate and depth, avoiding leading on the chest, and avoid excessive ventilation. However, knowing those 5 factors is the easy part. Performing these simultaneously well is difficult, and unfortunately, there is a wide variability in the quality of CPR our patients experience. The American Heart Association's digital resuscitation portfolio is the preferred solution to uniquely and efficiently deliver safe and effective CPR quality improvement. Our digital programs, deeply rooted in the latest science, lead healthcare organizations on an immediate journey to high quality and verified CPR competence to maximize life-saving outcomes. The time for digital is now. Initially released about 20 years ago, HeartCode served as one of our first co-developed solutions from the Laerdal AHA Alliance. Since that time, we've been on a continuous journey of providing the market highly impactful e-learning solutions that have prepared healthcare providers to respond in the most critical moments of a patient's life. For the past 8 years, we have worked tirelessly to develop and deliver our breakthrough resuscitation quality improvement program, which offers verified high-quality CPR skills competence through the use of a self-directed, low-dose, high-frequency solution that helps save more lives. These solutions are efficient, saving learner and instructor time, saving precious time to stay focused on patient care. And through the use of mannequin feedback, these solutions are extremely effective at ensuring every learner performs and masters the 5 key skills of high-quality CPR. In the current season we are in, it is important to note that these solutions remove the need for classroom learning, thus supporting physical distancing and a safe learning experience. High-quality CPR saves lives. The members of our RQI community continue to experience improved cardiac arrest outcomes when patients reliably receive high-quality CPR. Our goal for this session is to begin to answer the main questions you have about the new changes, specifically as they relate to your role as RQI and HeartCode administrators. But more than administrators, you're now members of the RQI community. We'll focus on a few key areas today: the RQI community membership benefits, new and improved e-learning experience, a smooth transition for your organization, new resources and program options, and accessing all of this for program success. We are committed to ensuring that your organization is fully capable to excel with the implementation of our digital portfolio. So I'm excited to introduce our new RQI community. You automatically become members of this community if you've enrolled in our digital programs, specifically RQI and HeartCode Complete. As part of this community, you are part of history today. For the first time ever, the American Heart Association guidelines for CPR and emergency cardiovascular care are releasing new, updated courses and materials for healthcare providers, for provider education and quality improvement on the same day. The AHA digital portfolio provides healthcare providers and organizations a complete end-to-end solution that includes learner and data management through the integration with learning management and human resource information management systems, a team of resources and personnel to support the initial setup and activation of your program. Community members also receive the support from dedicated impact managers who work with organizations for overall success. We are able to provide RQI community members utilizing RQI and HeartCode Complete immediate access to program updates and science changes from the American Heart Association. You are all members of a community focused on resuscitation quality and improving patient outcomes, ultimately saving more lives every year. Russell will guide us through our next portion of today's presentation to share some of the exciting new features and improvements available today in our new digital portfolio.
Thanks, Chris. We have a lot of amazing improvements to share with you today. However, the foundations for RQI and HeartCode will remain the same. In a few minutes, I'll share more on what is new, but I first want to reassure you that the fundamentals for the administrator and learner journey will not be changing. Administrators will continue to have the option to assign the RQI entry course or the RQI prep course to start new learners in their RQI journey. When a new learner has successfully completed either the RQI entry course or the RQI prep course, they will receive their initial AHA RQIE credential and begin the cycle of low-dose, high-frequency RQI learning activities. Each quarter, learners will complete a brief combination of e-learning assignments and high-quality CPR psychomotor skill activities at RQI simulation stations that will ensure verified competence and reinforce mastery learning. I also want to reassure you that the fundamentals for the administrator and learner journey for HeartCode Complete will remain the same. HeartCode utilizes the combination of e-learning and psychomotor skill activities at a simulation station. When completed, learners will receive the traditional AHA e-card. Now that we know the foundations will remain strong, I'm excited to share several of our exciting new improvements. Starting with RQI. We will now be including a brief 20-question BLS cognitive assessment that is in addition to the verified competence and high-quality CPR skills required to complete the RQI healthcare provider BLS entry assessment. To ensure that we provide a consistent educational experience, we have also aligned all of the e-learning objectives between the basic and advanced RQI entry and RQI prep assignments. Several organizations use a combination of RQI and HeartCode Complete to meet their learner needs. So we have also ensured that there is full alignment in learning objectives between the RQI courses and any of their corresponding HeartCode programs. We are also now providing learners access to the AHA provider manuals throughout their full course experience when using RQI. I hope that you're ready because we have some incredible, first time ever, truly breakthrough improvements available today for both RQI and HeartCode 2025. Flexibility matters. So now our new RQI and HeartCode programs support mobile responsive design, enabling learners to complete e-learning assignments on smartphones and tablets. Keeping with the theme of flexibility, our new programs are also supported across multiple web browsers, including Microsoft Internet Explorer, Microsoft Edge, Chrome, Firefox, and Safari. We also now include the option for learners to select how they will experience our new content based on their contextualized preference as either an in-hospital or a pre-hospital provider. We have added this option for all of our basic and advanced courses. Today, we are also simultaneously releasing, for the first time ever, multiple language supported options within all of our RQI and HeartCode basic life support courses. These supported languages include English, Spanish, Chinese, German, Japanese, and Portuguese. We have a passionate commitment for inclusive design. To ensure that all learners can be successful with our programs, we have achieved WCAG 2.1 AA standards for web accessibility with our BLS, ACLS, and PALS courseware. And perhaps the most exciting item that I have to share with you today is that in partnership with Area 9 Lyceum, we have dramatically improved the learner experience to include the power of our new true adaptive learning for our RQI and HeartCode 2025 programs in BLS, ACLS, and PALS. The addition of true adaptive learning powered by Area 9 Lyceum for RQI and HeartCode is a major breakthrough to improve the effectiveness and the efficiency of the learner experience. The beauty of adaptive learning is that it offers the standard benefits of e-learning, such as flexibility, convenience, and learning at your own pace. However, with adaptive learning, the course and content and the educational experience is personalized for each individual learner. This helps to guide learners onto the most efficient path to mastery learning, addressing the individual needs of a diverse learner population. This helps to account for prior knowledge of the content and adjusts for varying rates of how new information is absorbed. What separates our adaptive learning experience from traditional models is that true adaptive learning is powered by Area 9 Lyceum. The learning algorithm seamlessly adjusts the content as the learner progresses through the course based on their strengths, weaknesses, and associated confidence levels. Unlike traditional adaptive learning programs, true adaptive learning adjusts with the learner throughout their full e-learning experience. With true adaptive learning, we can progress a new or even experienced learner from being unaware of what they don't know, also called unconsciously incompetent, to becoming aware, informed, and actually verified competent in a smooth and enjoyable process. This model empowers RQI and HeartCode 2025 learners to achieve mastery learning with verified cognitive competence that is very similar to how RQI verifies competence in high-quality CPR skills. The entire experience is focused on learning for life-saving impact. For comparison, most classroom and even e-learning models follow a very linear sequence, slide after slide, page after page, or video after video. For a visual example into how true adaptive learning pathway works, the diagrams that I will share are actual paths that 3 unique learners took as they built proficiency using a course powered by Area 9 Lyceum. Each bubble represents a learning objective that would be required for a learner to successfully complete the subject. The size of each bubble represents the number of interactions a learner had with each learning objective during their experience. Green shows the first learning objective in the course, and red shows the last. Learner 1 progressed quickly as they demonstrate immediate proficiency on 88% of the learning objectives. In other words, they knew much of the course material before they started. We can therefore quickly assess them and teach them the tiny fraction they did not know. Learner 2 requires more support. Note that they are 41% unconsciously incompetent. What that means is they were actually overconfident in their knowledge in the subject and lacked awareness of their gaps. It takes them twice as long as learner 1 because the focus is on learning, by helping them recognize their misconceptions and guiding them towards success. Learner 3 has as much to learn as does learner 2. However, they are much more aware of their initial deficiency, and you can see how they uniquely struggled with one learning objective in particular. The adaptive engine moves the learner backwards and forwards through the learning objectives as they succeed, and of course, sometimes they struggle to learn. As you can see, the path is anything but linear. Linear is the easy choice when all you care about is that the learners just complete the course, and not if they really care about learning anything. As soon as the measure becomes mastery or proficiency, the path needs to adapt to the needs of each individual. This 4-to-1 spread in time to complete to proficiency is quite common when we consider that there are all differences in what we know and how we learn. Personalized learning is so important for resuscitation to ensure that we are prepared to save a life. So just to reinforce, what is our new true adaptive learning? It's a powerful, personalized learning experience. As you hopefully already know today, the AHA has also released the new 2020 guidelines on CPR and ECC. We will now cover how members of the RQI community have special access to the most recent science changes. Being a member of the RQI community by using RQI or HeartCode Complete has major advantages, and access to the latest science and updates is absolutely one of them. For the first time ever, all of the new RQI HeartCode 2025 BLS, ACLS, and PALS courses available today have the new science changes integrated into the courseware. We are also excited to share that members of the RQI community will be provided free access to the new AHA Science in Service course that was also released today. The Science in Service course is a brief e-learning module with a complete overview of the most recent science changes for the care of patients who require resuscitation. The course also includes continuing education credit upon full completion. The Science in Service course is immediately available for our RQI one-stop enterprise members. You can assign this course to your learners when you desire. RQI one-stop enterprise customers are organizations who are accessing content directly through the RQI one-stop platform. We will share additional details for how the RQI community members who use a third-party LMS can access the Science and Service course in the next section. So as community members, how you access the most recent science updates? The most recent science has been already integrated into the new RQI and new HeartCode 2025 courses. Also, members of the RQI community will receive free access to the AHA Science and Service course. I will now hand it back off to Chris to share how you can transition to our new and updated courses.
Thanks, Russell. Let's jump into how we can create a smooth transition for your organization. We've talked about the fact that the new programs are ready today. I'm going to take us through the various timelines that translate this into practical details as you prepare for transition. First, let's cover some general principles. Then I'll take you through the specifics for each of our various customer types based on how your organization accesses content. As you know, the new content is available today, including free access to the Science in Service course. There are two very important dates to cover that relate to a hard switch to the new guidelines updated course. January 1st, all new RQI assignments must be based on the 2025 versions. And February 1st, all new HeartCode assignments must be based on the 2025 version. But we've made it easy for you to prepare for the January 1st and February 1st dates by versioning all existing assignments on these dates. What does versioning mean? Versioning means we will automatically make sure any existing assignments point to the new RQI or HeartCode 2025 courses. In other words, you will not have to make any changes to existing assignments if you choose to wait for these dates to make the transition. Since we know that you may need time to prepare your organization, you have the flexibility to make this change between now and the January 1st date for RQI or the February 1st date for HeartCode. When the courses are available for assignment during these periods depends on if you are an RQI One-Stop Enterprise customer or a community member using a third-party LMS connection. As Russell mentioned earlier, RQI One-Stop Enterprise customers are organizations who are accessing content directly through the RQI One-Stop platform. I will cover the details in the next slides. In addition, we will be hosting another round of webinars during the first week of November, focusing on the various options. There's more to come on that later. Two additional items I want to mention. We do use a concept called finish what you have started, meaning users will always finish the version of a course that they have already started, even if they cross the January 1st or February 1st dates. This avoids confusion for learners and ensures that there is no loss of progress or other disruption for a learner who has already started a course. Also, for organizations who continue to utilize older versions of HeartCode and RQI, these have not yet transitioned to HeartCode Complete or RQI 2020 over the past 2 years, will need to make that transition first. However, you can move straight into using the RQI or HeartCode 2025 courses when you make that transition. This first scenario covers our one-stop enterprise customers. As mentioned previously, that is any organization who accesses HeartCode and/or RQI directly through one-stop. We will cover third-party access in our next slide. RQI One-Stop Enterprise members have immediate access to assign the 2025 versions and Science in Service today. You still have a choice to continue to assign the current 2020 course versions until January 1st for RQI and February 1st for HeartCode Complete. But if you make no changes, all assignments will automatically move to the new programs on those dates as well. The next scenario includes members that access RQI and HeartCode through your own LMS. There are two categories within this group. The affiliated third-party LMS platforms, which include LMS providers where a formal agreement exists with RQI partners. These include HealthStream, Relias, Healthcare Source and Net Learning, Care Learning, and LearnSoft. Unaffiliated LMS platforms include all other third-party LMS providers. In both cases, you will continue to assign the current 2020 versions for the time being. While we have technical testing that has been ongoing, due to the science embargo, testing on the final full programs with third-party LMS organizations can only start today. Once that testing is completed, we will be providing a new SCORM package, also known as the course package, available to you if you choose to switch learners or demo the new courses earlier than the January 1st date for RQI or the February 1st date for HeartCode. Otherwise, the switch will happen automatically on January 1st and February 1st for RQI or HeartCode Complete, respectively. We will work directly with our affiliated LMS platforms to coordinate the rollout of the new courses, including access to new Science in Service. For unaffiliated LMS customers using an LMS other than those listed earlier, your RQI Impact Manager will assist you in providing access to the new courses for you to publish on your LMS. In both cases, this is only necessary to obtain the new AHA in Science in Service and/or for an early use of the new RQI and HeartCode 2025 programs. Just a reminder, all existing assignments will be automatically switched on January 1st and February 1st. More details will be available in the upcoming webinars that will occur in the first week of November. To reinforce when can you transition to the new courses, you have flexibility. RQI One Stop Enterprise members can access the new courses today if they choose. All third-party LMS customers are coming very soon, and all content will be automatically switched for all customers on January 1st for RQI and February 1st for HeartCode Complete. I'm going to now hand it back off to Russell to share some of the options coming to the RQI community.
Thanks, Chris. In this next portion, I will share some of the new additional resources and program options for our members. Our team's been working hard in the background to continue to provide you and your organization new benefits and value. First, as of today, we're now offering a powerful new subscription option for member organizations of the RQI community. A new AHA digital reference library has been developed so organizations can provide their learners access to AHA reference materials through an annual subscription. This additional feature can be enabled at the organizational level, providing all learners with access to resources that include the AHA Handbook on Emergency Cardiovascular Care, access to all of the AHA provider manuals for BLS, ACLS, and PALS, and access to the complete set of the 2020 guidelines on CPR and emergency cardiovascular care. For more information on how to add this new feature to your organization, please contact your RQI Impact Manager. I'm very excited to share with you that we have developed a new RQI PGO simulation solution. The RQI PGO solution enables both our in-hospital and pre-hospital customers to provide RQI and HeartCode Complete programs to learners who may not have access to a main campus or a location with a traditional simulation station. For example, RQI PGO has been designed for use with freestanding locations within a healthcare system that would be considered off the main campus, including large clinics, standalone emergency rooms, surgical centers, or other similarly sized facilities. And also for use in pre-hospital or public safety organizations with locations that may be distributed across a city, a county, or more dispersed across a broader geographic area. The RQI PGO solution provides the essential elements required to successfully utilize RQI or HeartCode Complete in one simple subscription. We believe that you will find the new RQI PGO solution as a highly valuable and very cost-effective alternative option to ensure that all of your employees have access to verified skills competence in high-quality CPR. I have one more amazing announcement that we are very eager to share with the members of our RQI community. We have been working very closely with our friends at the American Academy of Pediatrics, and we will be releasing a new RQI for neonatal resuscitation provider course available in June 2021. It is my absolute pleasure to introduce Dr. Janet Patterson. Dr. Patterson is the Senior Vice President of Global Child Health and Life Support at the American Academy of Pediatrics and is here to share more on this exciting announcement.
Thanks so much, Russell. Today, I am thrilled to announce that we at the American Academy of Pediatrics have entered into a strategic relationship with the American Heart Association and Laerdal through RQI Partners. Our mission at the AAP is to improve the physical and mental well-being of all children everywhere. And I know this collaboration will propel us toward our aspirational goals. Through this collaboration, we'll develop programs, products, and services to improve the effectiveness of the Neonatal Resuscitation Program, or NRP, as many of you already know it. In pediatrics, we have a saying that children aren't just little adults. And it's also true that newborns aren't just little children. So it's critical that newborns get the specialized treatment they deserve when they're in need. For the first time, low-dose, high-frequency practice on the critical skills in newborn resuscitation will be made easily available. And for the first time, RQI for NRP will focus on ventilation as the top priority in resuscitating newborns. The NRP program will always be guided by science. With the launch of the new guidelines earlier today, we're excited to move forward with the latest in newborn resuscitation science in our next edition of NRP with the textbook and supporting courses and programs in June of 2021. RQI for NRP will launch in June 2021 as well, and will have all of the characteristics of the RQI portfolio that you have come to know and love. But it will focus on neonatal resuscitation, and it'll complete the well-rounded resuscitation portfolio of AAP, AHA, and Laerdal. We'll continue to keep you apprised of our progress with RQI for NRP. More details are expected early next year, but if you want to be the first to know, you should go to the website and sign up. So please, join me today in celebrating the beginning of a new era, where practice is made easy with RQI for NRP, a program with a singular focus on improving resuscitation for the smallest patients around the world.
Thank you so much for joining us today, Dr. Patterson. We are excited to have the American Academy of Pediatrics join the RQI portfolio and continue our shared mission of saving more lives together. I hope that you can all sense and see and share in our enthusiasm for a few of the powerful new offerings that we will be adding to the RQI portfolio of solutions for our community members, including the new AHA reference library option, our new RQI Go subscription, and how amazing is it to be able to offer RQI for NRP in partnership with the American Academy of Pediatrics coming next June. I will now pass it back over to Chris for the final portion of today's presentation.
Thanks, Russ. In this final section, I'll cover how we will ensure that you are successful with our new programs. I want to end the session reminding everyone of the resources we have in place to help you on this journey. As a member of the RQI community, which includes RQI and HeartCode Complete, you have access to a range of resources to support you. As members, your support starts with your impact manager. Impact managers are your advocates, champions, and experts. They are your first line of support for all questions and requests. Our second line of support is the Customer Support Center and our implementation team members. And finally, if necessary, we all work directly with our development teams to make sure you are receiving the best support possible. But the next set of resources comes directly from you. What better group of experts than those of you living and breathing these programs every day? Run Online is your source for enduring resources, guidance, and peer-to-peer support, available at your fingertips when you need it. This forum is a place to share ideas and ask questions of other members of the community. We've also used the Run Online as a simple way to access all of your program resources. We continually update all resources, so as administrators, RQI community members now, you always have access to the newest materials, software updates, and program information. In addition to the online resources, we've established a group of expert customers known as lighthouses. A lighthouse is a hospital or pre-hospital organization that has been recognized for being highly collaborative and for continuously demonstrating best practices with resuscitation quality improvement. With a reputation for top-notch quality, high patient satisfaction, and efficient processes, our lighthouse organizations align with the mission of the American Heart Association and RQI partners to eliminate preventable death from sudden cardiac arrest. The invitation to join with other organizations in this high affinity network empowers organizations to advocate for life-saving resuscitation programs, distinguish them nationally among their peers for quality and resuscitation excellence, inspire them to train, guide, and consult other organizations in the referral network. collaborate with RQI staff as clinical and educational subject matter experts, and finally, to participate and run conferences or present at RQI events. We've covered a lot of new and exciting announcements during this webinar. We believe that you will enjoy the benefits of being an RQI community member. Enjoy the new and dramatically improved learner experience, including true adaptive learning in RQI and HeartCode 2025. Transition smoothly to access our new course content. Celebrate the addition of resources and program options, and most importantly, be supported and successful with access to all of our resources. So where do we go from here? I know we've barely scratched the surface today, and especially if you've been attending the earlier sessions, you're probably in information overload right now. So I'll end here with a few parting thoughts. The next round of several webinars will be focused on the details of the transitions and will be scheduled based on the different LMS scenarios. This will allow us to provide greater detail and allow for interactive questions. As these are scheduled, your impact managers will be reaching out to you with more details on how to sign up. And as always, your impact manager is your go-to person for help, questions, and requests you may have. They are here for you along this journey. One last reminder, questions from today's session can be submitted through the website shown here, rqipartners.com/AHA guidelines-QA. On behalf of myself, Russell, and all of the employees at RQI Partners and our parent organizations, thank you for being a member of our RQI community. And thank you for your ongoing commitment to saving more lives together.